When we think of breast surgery, we often think of augmentation. As it is the #1 procedure in Canada, but there are other options available depending on your concern. Here with more, we're joined by Dr. Ian MacArthur from Kanata Plastic and Cosmetic Surgery. Good morning.
Good morning.
So let's just talk about that a little bit. When we think of breast surgery, we often think of augmentation, but there are other options as well.
Yeah, I do a fair amount of breast surgery, and so augmentation, nanoplasty, adding breast implants is very common. I also do a lot of Mastopexy surgery, which is a breast lift, as well as breast reduction surgery.
So let's talk in general about breast augmentation surgery.
Sure.
Why do people go in looking for this option?
There's different reasons. Some people are looking to add more volume or improve the shape of their natural breasts. Other people have lost some weight and want to get a more youthful appearance. And other times people have an asymmetry that they were born with and they're looking to correct that.
And what is some of the concerns that some of your patients would have if they're thinking about breast surgery?
The biggest concern I'd say is being at the right size after surgery and getting, the expectation that they were hoping for. So because of that, we spend a lot of time with patients really trying to figure out what would be the best surgical option and what would be the best implant for them.
Perfect. So we do have some photos that we want to kind of scroll through so people can have a better understanding of what surgeries you actually do.
Sure.
Can you maybe talk about this first patient and what they were looking for?
Sure. So this is a patient of mine who came to the clinic because she wanted to increase the size and volume of her breasts and get a bit more fullness. And so she was a primary breast augmentation patient, meaning that she just had breast implants placed underneath the muscle.
And where would the incisions be for this sort of augmentation?
So the incision is called an inframammary scar, meaning that it's hidden underneath the breast. And so when the breast hangs over it, it conceals the scar.
And is the procedure invasive at all?
Well, it's a surgical procedure, so
Right.
we have to make an incision and make a space for the implant. It is an outpatient procedure, meaning people are able to go home right afterwards.
Okay.
Most of the stitches are dissolving, and people are up and about, right after surgery.
And what are the different type of implants that are available?
There's different kinds in terms of the fill volume. So there's different sizes of implants. There's different types of implants, meaning saline or silicone, which refers to whatever's inside the implant. There's also different shapes of implants. So there's round implants, but we also use anatomic implants.
And how does a patient go about deciding what size, what shape, and what to use it as an implant?
It really depends on their goals and sort of where they're starting from. So we spend a lot of time talking to people. We take a lot of measurements beforehand, and we also often get people to bring in photos of results that they like.
Okay.
And using all those things, we come up with a surgical plan.
So we're also going to discuss mastopexy today. Can you explain what that is?
Sure, a mastopexy is a breast lift procedure.
Okay.
And so it's done to correct changes from aging or gravity or weight loss.
So we're looking at some more photos. Can you explain what this patient came in looking for?
Sure, so this is a patient who lost a little bit of weight and she was looking for more fullness in her breasts as well as a perkier look. And so she decided to have an operation called an Augmentation Mastopexy, where we lift the breast up as well as adding an implant.
And what sort of scarring would be on this sort of procedure? Would you have to do 2 surgeries, or is it all kind of done in one with the lift and the implant?
It depends on what the patient's goals are. Sometimes we do it all in one, sometimes we split it up.
Okay.
And the scar, looking at her, she has the scar around the areola and one straight down.
Okay. And we do have another series of photos that we do want to show. Can you explain what the next patient came in looking for?
Sure. So this is a patient who gained and lost 200 pounds with pregnancy, and because of that, she had a lot of extra skin.
Okay.
And so among other operations, we did a mastopexy surgery.
And so with this surgery, there was no implant involved?
Correct. So she was very happy with the size that she was before her pregnancy. She just wanted to have the breast lifted up.
And what is the recovery like in terms of this procedure?
For this operation, it's probably about 1 to 2 weeks off of work,
Okay.
and then about a month off from doing any sort of heavy exercise.
And can you just explain where the procedures do take place?
Sure. So we have a private surgery center located in Kanata. It's entirely dedicated to cosmetic surgery, so it's not like going to a hospital, and all the surgery happens on site there.
Fantastic. Thank you so much for joining us today.
Thank you.